Greeting everyone. Beforehand, I would like to thank to all the participants because we as SGD B3 can present our paper entitled Hajj Travel in Health Perspective. Let me introduce myself. My name is Yanti Graciella with my last 3-digit number is 162. This is our member of SGD B3. Then we can start with an introduction. Every year, the Hajj pilgrimage always receives attention from the Ministry of Health and Health Service Provider because of the Hajj pilgrimage is the one of the largest gathering in the world. Around 3 million Muslims from around 180 countries will gather in Mecca. This indicates that the population density will reach around 7 people per square meter. This is certainly a major health threat. Health is the one of the important points that needs to be developed so that the pilgrims can make their pilgrimage comfortably. Adequate coordination is needed between primary healthcare, hospital, and also the embarkation stage. Health service provider is needed to carry out the physical examination to avoid and treat comorbid disease in pilgrims so that it is hoped that disease can well be controlled. Education also has important role so that the pilgrims remain aware of their health. Even though health outcomes are still far from the target because pilgrims' health problems are still too abstract and limited by little research, studies still show that pre-travel preparation can still improve health outcomes. Therefore, further study of the medical travel is needed to deal with this problem. This is our problem formulation and the purpose. And for the benefits, this literature is to present the proper information about Hajj travel in health perspective. This literature explains the overview, characteristic, health risk, preparation, maintaining wellness, and post-Hajj travel surveillance in health perspective.
Hajj is the Islamic pilgrimage to the holy city of Mecca in Saudi Arabia, which adult Muslims must perform at least once in their lifetime. Hajj is the fifth of the fundamental customs and institutions of Islam, known as his 5 pillars of Islam. The ritual of pilgrimage begins on his 7th day of Dhul Hijjah, or the last month of the Islamic calendar, and ends on the 12th day. Hajj is the responsibility of all Muslims who are physically and financially able to perform the pilgrimage, but only if their absence does not burden their families. You can also designate a relative or friend who will be participating in the pilgrimage as a representative and perform the pilgrimage on your behalf. They entered Mecca, walked 7 times around the holy shrine, called the Kaaba in the Grand Mosque, kiss or touch the black stone on the Kaaba. Thank you.
Hello, my name is Wildan Mahsyar and my last number is 174. And now about characteristic of Hajj people. Indonesia is the country with the largest quota of Hajj pilgrims in the world. In general, the Hajj pilgrims in 2023 and before the years before consists of almost all age groups with various educational and economic backgrounds, and the majority were women. In 2023, as many as 29.3% of the pilgrims were elderly. The large proportion of elderly people is common occurrence because, especially for the countries with a large number of Muslims, the waiting time to go on the Hajj could be tens to decades of years. And based on data from 2019 Cisco Hajj, it was recorded that 62 to 67% of Hajj pilgrims were high-risk pilgrims. High-risk pilgrims are those who have health risk factors and health problems, and then during the Hajj, around 73.62% of Hajj pilgrims have to receive outpatient treatment, and around 8.62% have to be hospitalized. Some of the most common diseases that require outpatient care are acute nasopharyngitis, acute upper respiratory infection, myalgia, non-insulin dependence, and dyspepsia. And the most common illnesses that require congregants to be hospitalized are pneumonia, COPD, dementia, congestive heart failure, cerebral infarct, dyspepsia, and non-insulin dependent diabetes.
Hello everyone, my name is Putu Gita Nirajanari and the last three digits of my student number are 049. I'm here about to explain the health risks from Hajj. The first one is nervous system. One of the diseases on the nervous system that is most often experienced by person during Hajj is IMD or invasive meningococcal disease. This disease can be caused by viruses named Neisseria meningitidis. Hajj travel is an activity that is followed by many Muslim pilgrims from various countries. This condition can increase the risk of IMD transmission, so that the pilgrims are required to immunize in the form of quadrivalent polysaccharide vaccine before doing a travel to doing a Hajj in Mecca. Okay, the next one is cardiovascular system. Hajj travel is an activity that requires a lot of energy. Intense physical activity in a crowd accompanied by dehydration due to excessive sweating can refer to ischemia and heart attack. Cardiovascular disease is the highest cause of death among pilgrims who come to Mecca to perform Hajj. Based on this, it's very important for prospective pilgrims to consult a doctor before going on a Hajj trip to prevent this. Okay, the next one is dermatological. Skin disease ranked as the second most common disease found in health care center during Hajj. Skin infections such as pyoderma are often found due to prolonged activities such as standing and walking and hot temperature. And pilgrims are also at risk of heat-related injury due to the heat in Mecca, especially in summer, where the temperature there can reach 45 degrees Celsius or more. So that to prevent this, the use of footwear, sunblock, and umbrella for shelter is highly recommended for the pilgrims. That's all from me. The next slide will be presented by my friend. Thank you.
Hi, my name is Patricia and Jotan, and the last three digits of my student number is 171. As for the respiratory system, respiratory tract infections are common among Haji pilgrims due to crowded mass gatherings in limited spaces, increased pilgrim population, and heightened activities emit pollutants into the air around the Al-Haram Mosque. A study analyzed air pollutants, identifying road traffic during morning peak hours as the primary source. Another study in the Haji season found gram-positive bacteria, particularly cocci, as the prevalent microbial air pollutants, with humans identified as the main source. The COVID-19 pandemic also impacted this Hajj season between the year of 2020-2022, with varying attendance and stringent measures. In 2020, only 10,000 pilgrims were allowed with a 14 days quarantine, despite no reported COVID-19 cases there. The 2021 season saw increase in pilgrim numbers, but it's also restricted to vaccinated individuals only and a digital application for their COVID-19 status. Respiratory symptoms were lower, and the success led to larger attendance in 2022, with effective infection control. However, there's still a lack of studies on respiratory and non-respiratory microbial infection post the 2022 Hajj season. Okay, as for the digestive system, health hazards from food and waterborne disease are a large concern during the Hajj mass gatherings. A study with 1,363 predominantly male pilgrims with the age average is 50 in 2019 found 9.7% experienced gastrointestinal problem and 5.1% of them had diarrhea. Also, most pilgrims practice good food and water safety, but some engage in risky behaviors like unsafe temperature storage and sharing. Factors such as gender, nationality, and experiencing GI symptoms during Hajj were linked to a better knowledge and also the better practices during this Hajj season. That's all from me. Thank you.
Hello, doctor. Allow me to introduce myself. I'm Michael Jonathan Raya with 3 last digit student ID number 182. Now I'm going to explain about the preparation of Hajj travel in health perspective. So the Minister of Health of Saudi Arabia has published a guideline containing requirements that should be met before doing Hajj travel. The guideline includes pre-travel health assessment needed to be fulfilled, such as vaccinations. The required vaccination is COVID-19 and meningococcal meningitis. There are also several recommended vaccinations, such as diphtheria, tetanus, polio, measles, mumps, rubella, and seasonal flu or influenza. Besides vaccines, the Ministry of Health also suggests that travelers to purchase a comprehensive travel health insurance. Travelers may also do general health checkup with their general practitioner or specialist to ensure their overall health is well enough. Also, when a traveler has been prescribed a medication before, make sure that the medication is supplied enough during the travel. Don't forget to bring additional health equipment like first aid kit. Always pay attention to hydration and nutritional intake while traveling. And that's all for me. Thank you.
Allow me to introduce myself. My name is Yohanes Nicholas with the last digit number 089. Maintaining good personal hygiene, especially when it comes to keeping our hands clean, it is really important. Germs often spread through our hands, so it's crucial to know and practice proper hand hygiene. Before traveling, it is a good idea to share basic hand hygiene tips like washing hands with soaps or using hand sanitizer before meals or after sneezing and coughing. Presentation or announcement can help spread this information effectively, preventing any misunderstandings. It is also a smart move to carry your own hand sanitizers in case you can't find a place to wash your hands. When it is hot, protecting yourself from the sun is a must, especially during some summer travels when temperatures can soar up to 45 degrees Celsius with 80% of humidity. Proper sun protection is a key to avoid heat-related illness, ranging from mild symptoms like headache and heart cramps to more severe issues like heat stroke. Staying hydrated by drinking plenty of water and using head coverings like an umbrella or white cap can lower the risk of heat-related illness. And don't forget to use sunscreen with a good SPF to guard against sunburn and skin cancer caused by the sun's UV light.
Thanks for the opportunity. First, I'm going to introduce myself. My name is Sienny Kuswardi with the last three digits of my student number is 004. I'm going to explain how to maintain wellness during Hajj travel. For Muslims, the Hajj is a major pilgrimage and staying well while traveling is essential. Pack a basic first aid kit and any prescription drugs that may be required. Know where the local medical facilities are located. Hot weather during the Hajj may cause dehydration, so pilgrims should drink lots of water. Use a high SPF sunscreen, sunglasses, and a wide brim hat for protection from the sun. It is vital to wear appropriate footwear as foot blisters may occur when walking in the scorching heat during the day. Walking barefoot is not advised as it increases the danger of cuts, burns, and infections, especially for diabetic pilgrims. Keep in mind that being well during the Hajj involves not just physical health but also emotional and spiritual health. Pay attention to self care first and ask for assistance when necessary. That's all from me. Thank you.
Hello, my name is Patricia Clarine Simpson with the last three digit number 125, and I'm going to be continuing the explanation on maintaining wellness during Hajj travel. To minimize the risk of developing upper respiratory diseases, pilgrims are highly encouraged to wear masks to protect the nose and mouth, especially for the elderly. It is best that the masks are self-made from soft materials and sprayed with a little water to prevent the respiratory tract from drying out too quickly. To preserve their stamina, pilgrims must get enough rest and eat nutritional foods. For geriatric patients who cannot have rice, eating 12 medium-sized dates can be a good replacement since they equal 200 calories. For older pilgrims, it is important that they are traveling with a good support system so that they don't get stressed out easily due to exhaustion, dehydration, heat, and anxiety, and if something were to happen, they always have someone close to call for help.
Hello, my name is Indra Dewi with the last two digits of my student numbers are 146, and I will explain about post-Hajj travel surveillance in health perspective. The Hajj, or pilgrimage to Mecca, Saudi Arabia, is one of the world's greatest annual religious mass meetings, attracting about 2 million people from 184 countries. Hajj is one of the Islam's 5 compulsory pillars, an obligation that all physically fit, able-bodied adult Muslims must do once in their lives if they can afford it, and takes place over 5 days during Dhul Hijjah, the 12th month of the Islamic calendar. The closeness of pilgrims owing to packed accommodations, congregations, and prayers offers an ideal setting for the transmission of infectious illnesses. As a result, many post-Hajj monitoring methods are routinely adopted to monitor and resolve pilgrim health issues.
Let me introduce myself. My name is Bagus Tresna Indra Putra Pramana with the last 3-digit number 104, and I'm gonna explain about post-Hajj travel surveillance in health perspective. So in Indonesia, pilgrims who are declared healthy upon arrival will continue to monitor their health. Attendees will be observed by their local health services for a period of 21 days in their respective locations. It is intended that in the event of health issue while monitoring, they will promptly notify the nearby medical institution. Early detection of infectious diseases such as COVID-19, MERS-CoV, meningitis, polio, and illnesses with the potential to result in a public health emergency of international concern or PHEIOC is the goal of this surveillance. And then a Hajj Pilgrim Health Awareness Card or K3GH will be given to pilgrims making the annual pilgrimage. If the sick congregation has a fever or other symptoms during the 21-day monitoring period, they should go right away to the closest health center or facility that has K3JH. The congregation is still asked to submit K3JH to the closest community health facility even if symptoms do not show up for 21 days. At the same time, as soon as the pilgrims arrive at the international airport or debarkation, health screening will also be conducted. This will involve monitoring the pilgrims in the Hajj debarkation dormitories, taking their temperatures with a thermal scanner and heat cannon, and looking for any indications or symptoms. A congregation will undergo further testing for antigens and further evaluation if symptoms of a fever or signs of an infection condition are discovered. If the reactive reagent findings are obtained, more testing will be done.
Thank you for the opportunity. My name is Putu Chandrika Rahma Dewi with the last 3 digits of students number 071. So here I would like to give the conclusion on this street project. Hajj pilgrimage is the Islamic pilgrimage to the holy city of Mecca in Saudi Arabia, which adult Muslims must perform at least once in their lifetime. In the perspective of health, various health problems in every aspect of Hajj pilgrimage may cause discomforts, such as in the nervous system, cardiovascular disease, dermatology, respiratory, and digestive problems. In order to maintain health in Hajj pilgrimage, the pilgrims can adhere to the pre-travel, during travel, and post-travel procedures. In pre-travel, pilgrims must follow the guideline containing requirements that should be met before doing Hajj. During travel in Hajj, the pilgrim expected to drink lots of water and using protection toward the sun. Lastly, in the post-travel, the pilgrims must do the health monitoring after returning to the home country. That's all from me and also for this B3 student project presentation. Thank you for the attention and may this student project can give some benefit to others. Thank you.